Thank you. And I want to, of course, thank everybody for joining us for this opportunity and this really opportunity to hear mostly from our health department, our director of public health, as well as Dr. Davis, who, of course, runs all of our programs at the health department as it relates to viruses, has gotten us through this COVID pandemic, and is here to talk about monkeypox as well. I'm Robert Garcia. I'm the mayor of Long Beach, and I want to thank particularly the community that are also watching in the media for being here. Just as a quick note, we are going to give an update. Then we're going to take any questions that the press might have. And then we will do after the questions. We will then go ahead and do any translation in Spanish for anyone that needs that as well. And I'm going to say a few remarks, and then I'm going to turn this over to Dr. Davis as well as Kelly Colopy, who will also have some additional remarks. So I want to just begin by noting that here in Long Beach, like across the country and across the world, are dealing with this outbreak of monkeypox, especially here in the United States. We know that the World Health Organization just recently declared monkeypox a global health emergency. We are taking this virus very seriously, just as we have the COVID pandemic, and that we continue to take on every single day. We know that cases are also increasing rapidly, not just here in Long Beach, but also across LA County and across the country. Now, our health department has been working around the clock to address monkeypox and to also work and understand that we have two public health emergencies happening at the same time. Both monkeypox as well as the ongoing COVID pandemic. Both are affecting our community and both need to be taken very seriously. Now, we also know that as of today, and the numbers are changing every day, we have 12 confirmed cases of monkeypox. These, of course, are presumptive cases. We believe they are monkeypox, so they get sent off to the CDC and lab work to get confirmation, but we're pretty certain all 12 are confirmed cases of monkeypox. Now, none of these 12 individuals have required any type of hospitalization. Certainly none have lost their lives, and so we're very grateful for that. And all 12 here in our city are isolating at home. Want to also just note that the city and our partners have given out about 300 vaccine doses here in Long Beach, and we have had about 1,600 individuals request vaccination. Now, that doesn't mean that all 1,600 are eligible for vaccination. Some are not yet eligible per the tiers that we've set up in partnership with the CDC and our partners. But 300 have actually received their vaccine. And just as an example, just yesterday we gave out close to 80 vaccines and vaccinations. I will also note that if you are on this list, if you have actually called the city, if you are one of these 1,600 people or so that have actually requested a vaccination, all of you will be contacted in the next 24 hours. We finally have enough vaccine to schedule your appointment if you are actually qualified to receive the vaccine. If you're not qualified, you'll receive a message that will let you know once you're able to, once the qualifications change. So once again, and this is very important, if you have requested a vaccine in the city of Long Beach, you're a Long Beach resident, through our phone system or through our registration system, you will receive a message within the next day so that we can work with you on getting you your appointment to receive your monkeypox vaccine. I also just want to note that for us here in Long Beach, a vast majority of the cases that have been reported, those that are currently isolating at home, identify as men who are either gay or bisexual. Now, it's important to say a few things about monkeypox. Anybody can get monkeypox. It has nothing to do whether if you're someone that is LGBTQ+, or whether you're straight, or how you identify. Anyone can get monkeypox in the same type of way. So that I think is very, very important to say. It's also important to remember that monkeypox is not an STI. It is not a sexually transmitted disease per se. And that monkeypox is transmitted through essentially skin contact. But we also know, and it's important to recognize, that many folks that are getting monkeypox are sexually active gay men, and it's usually because of skin-to-skin contact. It's also important to remember that you can get monkeypox not just through sexual intercourse, but also just by skin-to-skin contact, whether you have through whether your shirts are off or you're next to somebody, through hugging, through other types of methods. And so again, as a reminder, the entire community, anybody can receive monkeypox. I also want to note that because of the special impact to LGBTQ plus communities, particularly gay men, we have brought in providers, including the AIDS Healthcare Foundation, APL, which is APLA Health, the Long Beach Comprehensive Health Center, St. Mary's Care Program, and the LGBTQ plus Center of Long Beach to help us monitor, share information, and get impacted communities information. Let me also say that we've already given these organizations 600 doses directly so that they can also go out and give vaccinations for monkeypox directly to their communities and to the partners. And so they have their vaccinations. They've been undergoing training now, I believe, for the last week or so, where they have been getting training on how to give the monkeypox vaccine, and they're out now giving the vaccinations through their programs. And the city of Long Beach wants to thank them for their partnership and for their work. I also want to just thank everyone that has signed up. I encourage you, if you feel you've been exposed to monkeypox, if you meet a criteria as someone that is LGBTQ plus and is on PrEP or has been active, please sign up. You can go to longbeach.gov/monkeypox, sign up, register, and we will reach out to you and make sure that you get an appointment. And before I turn this over, the last thing I will note is we are working right now on putting together, which will likely be sometime next week, a drive-through type of clinic that we will set up, where folks will be able to come, drive to, walk up to, and receive their monkeypox vaccine, particularly if you've already signed up. And we're hoping at that clinic and in others in the future that we'll be able to reach a large part of the population that needs this vaccine. Let me also say as a reminder, and this is a message that we have already sent to our federal partners and to our state partners, that we do not have enough vaccine. And it is very important that even though we are committed to getting all the vaccine out that we have, that it is important for the federal government to get more vaccine out to not just local clinics, but the health departments, to the state, and to hospitals and health partners. And so all of that is incredibly important. And with that, I'm going to turn this over to our health department, beginning with Dr. Anissa Davis, who is our city's health officer.
Thank you, Mayor. Good afternoon. I'm going to talk about monkeypox signs and symptoms, as well as testing and vaccination information. So starting with the basics, monkeypox is a rare but potentially serious disease caused by a virus that is part of the same family as smallpox, although monkeypox infection has milder symptoms than smallpox. And as mentioned previously, there are currently 12 monkeypox cases in Long Beach. Monkeypox typically begins with flu-like illness, such as fever, headache, muscle aches, and exhaustion, and progresses to include a rash. Sometimes the rash is only one or a few lesions and maybe just in the genital area, but a lot of times it spreads throughout the face and body. And sometimes patients develop rashes without having flu-like symptoms first. Since this infection doesn't always look or develop the same way, it's important to pay close attention to any symptoms you have, as well as activities which might put you at risk, which we'll talk about in a moment. The good news is the type of monkeypox infections seen in this outbreak are rarely fatal, and most infections last 2 to 4 weeks and go away on their own without specific treatment. There have been no deaths in the United States to date. However, some groups can be at higher risk of severe illness, including children under the age of 8, people who have weakened immune systems, and people with common skin conditions like atopic dermatitis or eczema, and pregnant persons. These folks have a greater risk of developing severe disease and additional complications such as sepsis, pneumonia, encephalitis, and loss of vision. Monkeypox can spread from person to person through direct contact with the monkeypox rash or scabs on a person's skin, through intimate contact such as oral, anal, or vaginal sex, by touching the genitals or anus of a person with monkeypox, by touching fabrics, shared surfaces, and objects that were used by a person with monkeypox, such as bedding, towels, fetish gear, and sex toys, or through contact with respiratory secretions during prolonged face-to-face contact, including open-mouthed kissing. It can take anywhere from 5 to 21 days to develop symptoms once someone is exposed to the virus. Most of the time, however, symptoms develop in 7 to 14 days. Vaccines can prevent monkeypox, and medicines are available to treat the virus when needed. Now I'll turn to testing. Testing was in limited supply at the beginning of the outbreak, but currently monkeypox testing is available at numerous commercial labs. Healthcare providers can order monkeypox testing just as they normally would order other tests. If you have symptoms and you think you may have monkeypox, please call your healthcare provider. Healthcare providers will also be able to help figure out what treatment is needed for those who have monkeypox. If you do not have a healthcare provider and are experiencing symptoms, call the City of Long Beach's Public Health Information Line at 562-570-7907 for assistance. Next, I'll provide a vaccine rollout update. There is a vaccine called Jynneos, which can prevent monkeypox. Unfortunately, this vaccine is extremely limited in the United States right now. Currently, vaccine is only available for the following groups in Long Beach: people who were exposed to someone with confirmed monkeypox and do not have symptoms, people who have attended an event or venue where there was high risk of exposure to someone with confirmed monkeypox, gay or bisexual men and transgender people who are on HIV pre-exposure prophylaxis, otherwise known as PrEP, gay or bisexual men and transgender people who have attended or worked in saunas, bathhouses, sex clubs, circuit parties, or sex parties where they had anonymous sex or sex with multiple partners, and gay or bisexual men and transgender people with a diagnosis of gonorrhea or early syphilis within the past 12 months. The usual dosing schedule for Jynneos calls for 2 doses separated by 28 days, but we are currently prioritizing getting as many first doses administered as possible. We will expand eligibility as additional vaccine is available. The federal government anticipates distributing additional doses in the next few weeks. It's important to get vaccinated right away if you were exposed to the virus. Once you start to develop symptoms like a fever or a rash, the vaccine won't help you. I'll end by reviewing the treatment of monkeypox. Treatment will depend on how sick someone gets or whether they're likely to get severely ill, such as if they have a weakened immune system. As I mentioned before, most people will recover fully within 2 to 4 weeks without the need for specific treatment. However, pain management, preventing further skin infections, and other complications is important for these patients. An antiviral drug called tecovirimat, also known as TPOXX, was developed for the treatment of smallpox in adults and children. But the U.S. Food and Drug Administration and CDC allows its use to treat monkeypox during an outbreak. From the information available about this treatment, TPOXX may shorten the duration of illness. The TPOXX we have received from the federal stockpile is in a pill form. Healthcare providers will determine the need for this treatment with their patients and in consultation with the health department. I'm now going to turn it over to our health department director, Kelly Colopy, who will touch on our response efforts and community partnerships. Thank you.
Thank you, Dr. Davis. I'm really proud of our team. It's the health team that's been able to expand our operations and capacity to respond to this public health emergency in a very short time. Much of this is because of our learnings and our infrastructure built for the COVID response. In fact, it's the same team, so they've got it down. We're very proactive in our efforts. Even before we received the vaccine, our team established a pre-registration survey that you've been hearing about for those at the highest risk, so that we can contact people for appointments when they meet the eligible criteria. To date, nearly 1,600 people, as the mayor mentioned, have signed up to receive the vaccine, and we're continuing to schedule those who are eligible. We've expanded our public health information line to meet the demand for monkeypox calls. We're providing support and getting people connected to the resources that they need. To date, we fielded nearly 1,000 calls and have reached several hundred people. We opened a vaccine clinic at our main health facility and expanded vaccine operations to help people get protected as quickly as possible. And as the mayor mentioned, we've been able to vaccinate 300 people so far. In an effort to increase this vaccine, we've partnered with our local healthcare providers to be able to provide those services. The vaccine went to them last week, and they are starting to vaccinate. Outreach efforts include actively engaging with our trusted LGBTQ plus messengers to ensure they have the most up-to-date information, and staying in communication with key stakeholders through the Long Beach Comprehensive HIV Planning Group. These partnerships with trusted sources are important to ensure that the community feels supported and that we're able to receive valuable feedback to adjust our response efforts as needed. Recent outreach events included providing education and prevention information to attendees at the Pride Festival. We'll continue to keep a close eye on the situation locally, nationally, and around the world. As always, we utilize data to ensure that we are making proactive and equitable decisions. As more vaccine becomes available, we'll expand our eligibility capacity. To those who are currently most impacted, we urge you to take extra precautions to reduce the risk for monkeypox. That means talking openly with your partners about symptoms prior to any intimate contact, avoiding skin-to-skin or prolonged face-to-face contact with anyone who has symptoms, practicing safer sex, such as reducing the number of sexual partners, covering your coughs and sneezes, and making sure you're washing your hands often, which is also what you should be doing for COVID. As always, we stay up to date and avoid misinformation. Please visit our website, longbeach.gov/monkeypox. That allows you a space to learn more about the numbers who have been impacted, the symptoms, the registration for the appointments, phone numbers for phone call. Everything you need is on that website. If you're interested in receiving the monkeypox vaccine, please complete the pre-registration, which is available on the website. Those who sign up will be contacted, and as the mayor said, everyone who is currently eligible, who is currently on that list, will be contacted by tomorrow afternoon with opportunities for vaccine. You can also check with your healthcare provider to see if you are eligible to receive the vaccine. Our public health information line is available Monday through Friday from 9 to 5 by calling 562-570-7907 and can help with answering questions, scheduling appointments, and signing up for the pre-registration system in English, Spanish, Khmer, and Tagalog. Please follow us on Facebook, Instagram, and Twitter at Long Beach LB Health Department. And thank you. We are now open for questions. Okay, sorry.
So we're gonna just a little change. So I've been asked to do a short statement in Spanish. The full Spanish translation is gonna be after the question. So we're gonna go ahead and do it that way. So a short statement in Spanish, questions, and then the full Spanish translation. Estamos acá en la ciudad de Long Beach para hablar de Monkeypox, que sabemos que es algo muy importante ahorita en la comunidad. Ahorita no nomás acá en Long Beach, pero por todo el país y en el condado de Los Ángeles. Estamos ahorita hablando de Monkeypox y también, claro, de COVID-19, los dos que son algo bien serio, importante para la comunidad. Acá en la ciudad tenemos 12 gente que tiene Monkeypox. De estos 12 gente, nadie está en el hospital. Todos están en sus casas descansando y nadie, claro, ha morido de Monkeypox acá en la ciudad de Long Beach. Sabemos que es un virus muy diferente de COVID-19 y del coronavirus. También queremos decir que cualquier persona puede agarrar Monkeypox. Sabemos que la mayoría de la gente acá en la ciudad y en otras partes del condado que tienen Monkeypox son de la comunidad LGBT, son la comunidad gay que ha tenido Monkeypox más que otras comunidades. Pero también es importante saber que cualquier persona puede tener este virus y es transmitido no por sexo, pero por contacto a una persona a otra persona. Eso es como este virus puede ir a otra persona. So, quería además decir que acá en la ciudad de Long Beach, si tú quieres tener esta vacuna, lo puedes tener. Tenemos un website para poder registrarse, es longbeach.gov. con la /monkeypox. Está en la website también y pueden ir a la website o llamar el número y para mañana, un día, vamos a contactar a toda la gente que necesita su vacuna para traer la vacuna. Y hasta este momento ya hemos hecho, creo, aproximadamente 300 gente que tienen la vacuna. Ya, muchas gracias y Kevin Lee.
Mic drop. Good afternoon, everyone. I am going to open it up for media Q&A. We're going to limit it to one question each, please, just for the sake of time. So we're going to go ahead and start. Anyone over here? Yes.
Claro, eso es importante que la comunidad latina en español tenga la información. Eso es porque estamos hablando de esto hoy día. Eso es porque también si alguien contacta a la ciudad de Long Beach, hay gente en el Departamento de Salud que también puede hablar contigo en español, que es bien importante. También tenemos información en el website que por favor pueden leer. Estamos trabajando ahorita también con 5 o 6 diferentes clínicas acá en la ciudad de Long Beach que también trabajan con la comunidad latina y estas clínicas también tienen vacuna. So, no es nada más que pueden agarrar la vacuna acá en la ciudad y en la clínica del Health Department, pero también en estas 6 diferentes clínicas por la ciudad de Long Beach.
All right. Yeah, over here.
The question is, when do we expect to get enough vaccine? Yeah. Yeah, so within the current eligibility group, we are working very closely with LA County and with the state to identify resources. We anticipate additional vaccines showing up within the next week. It may not meet the full demand, but at least it will start to give us good progress on folks who are currently registered and eligible for the vaccine.
I just want to add to that because I think it's important to note that of those that are within the categories as laid out by the city of Long Beach that are eligible, we feel that we can manage that list with what we have and what's coming in, what we're expecting to come in. And again, most of all of those folks that have already signed up will be receiving notice in the next 24 hours on us getting them signed up for an appointment or getting them their vaccine. It's going beyond the current eligibility that we don't have enough vaccine for. And so when the eligibility changes, that'll be a signal that the federal government is actually getting us more vaccine.
Right. So the rate limiting step is the supply of vaccine. And so the federal government has different amounts that they're ordering at different times. So there will be more coming throughout the summer and then larger amounts during the fall and then through 2023. So we will kind of expand as we know what we're getting, and they're the ones that we're communicating with to get kind of what the timeline is. So more will be coming, but for right now it is in limited supply. It's a lot of conversation because it's new, so it'll be like within the next few weeks will be a certain amount, but we don't know how much yet, and then a little bit later we'll get the next amount. So yeah, it's a quick turnaround time. Like we're finding out and then we have to plan.
All right. Any more questions? Yes, right here. Purple.
So TPOXX, we do have supply stored, and it's also at the federal level as well. So it was approved for smallpox. That's what it's approved to be used for. So because we're using it for monkeypox, which is under an investigational new drug use, you have to go through a little bit more steps. So it's not necessarily that it's in like short supply. It's just that it's being used for a new thing, and so you need to go through more steps in order to get it. But anybody who needs it, we will be able to get it. We've put the protocols in place. We'll help with filling out the forms. The federal government and the state is also working to streamline what you have to do. So we will be able to treat people who need it. But most people don't. They need like pain control. They need to make sure that they're well hydrated, and we need to make sure they don't get more infections. But for those who are either having severe illness or at increased risk to have severe illness, we do have TPOXX ready to treat them.
Thank you, Dr. Davis. Yes, up front, Black. Yes.
So you're wondering what we have access to right now? Yeah. So we have our community partners. The mayor has shared are the center, APLA, AIDS Healthcare Foundation, Long Beach Comp, and the care clinic. Sorry. So all of those organizations have received 100 doses to go out and to be able to do the vaccine. They were trained up last week. The center is almost online. They are working through the last bit of paperwork required by the state to be able to engage. So they are already starting, everybody else is already starting to vaccinate. We received 500 doses over the weekend. So that's an update. So we had 400 before that. We had 1,000 before that. So we've received a total of right around 1,000 doses, including what we have distributed out to our partners. We have made appointments for people into August. So we've made 400 appointments. And then we will be hosting a vaccine event next week for those who are currently eligible and on our list. And everybody there, we anticipate that we'll have sufficient vaccine to vaccinate all of those folks, and we're hoping for more to be able to meet more demand. 100 doses per partner. Well, the clinic, our partners, right? We're not pulling back those doses, so we're anticipating that we're going to get another 500 in time for next week.
I think, real quick, I think we have a question over here.
So the question was, out of the 12 cases, how many identifies LGBTQIA+, and it's the vast majority.
Right here up front in blue.
So I'm going to try to repeat your question. Was basically, are we making this a gay disease? And is there a reason why we're seeing it more in the gay community? Is that? I think part of the variables that you named are definitely part of what's at play. So the fact that populations have good relationships with their providers, and so if they notice something that seems like it needs to be checked out, they have a easy avenue to get something checked out. So that is important. I think the important thing to remember about monkeypox is that it's been with us for the past at least 40 years. Its outbreaks have looked different at different times. So before the outbreak that we're currently having now, when it's been primarily in Central and West Africa, it looked one certain way. We had an outbreak here in the 2013, 2003 area where it was related to rodents that were imported. And that got passed to humans from rodents. The current outbreak that we're having now is primarily and disproportionately affecting men who have sex with men and gay and bisexual men and transgender persons. It could change and evolve. So I think that's what's really important, is that we're highlighting what the issue is right now. We're following the data, which is looking at the cases and making sure that we're doing the best communication and messaging given the reality of the outbreak that we're currently in. But it is definitely important to realize and for everybody to be aware that this is not a gay disease. The activities are activities that we all do, cuddling, sex, dancing, kissing. And so I think it is important for all of us to be aware and not panicked, but to be aware of what the risk activities are and to be aware that if you see a weird rash, that you need to get checked out. But right now we want to make sure that we're focusing the messaging on the outbreak that we're currently in.
We're going to go ahead and wrap it up at this time. We're going to go ahead and call up for Spanish interpretation. Amarani Cortez is going to come up for that Spanish interpretation right now. Thank you all for being here.
Buenas tardes a todos. Quiero primero comenzar en agradecer al alcalde García, a Dr. Davis y a la directora Kelly Colopy que han explicado la situación de la viruela del mono en Long Beach. El 23 de julio de 2022, la Organización Mundial de la Salud declaró que la viruela del mono era una emergencia sanitaria mundial. Esta declaración significa que los casos están aumentando rápidamente y la salud pública necesita una respuesta coordinada internacional. Nuestro Departamento de Salud ha estado trabajando las 24 horas del día para responder no solo a una, sino a 2 emergencias de salud pública, ya que el COVID-19 aún afecta a nuestra comunidad. Si bien el riesgo actual de contraer la viruela del mono es bajo, nos estamos tomando muy en serio esta respuesta. A la fecha tenemos 12 casos confirmados y presuntos de viruela del mono. Ninguno de las personas requirió hospitalización, todos están recuperando y aislando en casa. La mayoría de los casos reportados en Long Beach han sido entre hombres adultos que se identifican como homosexuales o bisexuales. Es importante tener en cuenta que cualquier persona que entre en contacto piel con piel o cara a cara con alguien con viruela del mono puede estar en riesgo. Debemos proteger la salud y la dignidad de todos los que pueden verse afectados por este virus. El estigma nos daña a todos. Nuestros esfuerzos de respuesta incluyen asociaciones continuas con proveedores de atención médica locales, incluidos AIDS Healthcare Foundation, APLA Health, Long Beach Comprehensive Health Center, St. Mary's Care Clinic and LGBTQ Center, para monitorear la situación, compartir información y recursos y proporcionar vacunas y otros apoyos críticos para los afectados. Nuestro Departamento de Salud y los socios comunitarios están trabajando de manera proactiva para diseñar y brindar información, recursos y servicios a todos, especialmente a aquellos que corren el mayor riesgo. Continuando con los conceptos básicos de la viruela del mono es una enfermedad rara, pero potencialmente grave causada por un virus que es parte de la misma familia de virus que la viruela, aunque la infección de la viruela del mono tiene síntomas más leves que la viruela. Los signos y síntomas de la viruela del mono generalmente comienza con una enfermedad similar a la gripe como fiebre, dolor de cabeza, dolores musculares y agotamiento, y progresa hasta incluir sarpullido en la cara y el cuerpo. A veces el sarpullido es solo una o unas pocas lesiones y puede estar solo en el área genital. A veces los pacientes han desarrollado un sarpullido sin tener síntomas similares a los de la gripe primero. La mayoría de las infecciones duran de 2 a 4 semanas y desaparecen por sí solas sin tratamiento específico. Sin embargo, las personas inmunocomprometidas pueden tener una enfermedad grave y complicaciones adicionales. El tipo de viruela del mono que se observa en este brote rara vez es fatal. No ha habido muertes en los Estados Unidos hasta la fecha. Sin embargo, es probable que algunos grupos tengan un mayor riesgo de enfermarse gravemente. Una vez expuesto a la viruela del mono, los síntomas generalmente se desarrollan en 7 a 14 días, pero pueden variar de 5 a 21 días. La viruela del mono se puede transmitir de persona a persona como a través del contacto directo con sarpullido o costras de viruela del mono en la piel de una persona, a través del contacto íntimo como el sexo oral, anal o vaginal, al tocar los genitales o el ano de una persona con viruela del mono, al tocar telas, superficies compartidas y objetos que usó una persona con viruela del mono, o por contacto con secreciones respiratorias durante contacto cara a cara. Las contramedidas médicas para prevenir y o tratar la viruela del mono están disponibles en forma de vacunas y antivirales. Hablando de pruebas, actualmente las pruebas de viruela del mono están disponibles en laboratorios comerciales. Si tiene síntomas y cree que puede tener viruela del mono, llame a su proveedor de atención médica. Si no tiene un proveedor de atención médica y tiene síntomas, comuníquese con la línea de información de salud pública de la ciudad de Long Beach al 562-570-7907. A continuación hablamos de la vacuna. La vacuna Jynneos es limitada en los Estados Unidos. Actualmente la vacuna solo está disponible para los siguientes grupos en Long Beach: personas que estuvieron expuestas a alguien con viruela del mono confirmada y no tienen síntomas. Si estuvo expuesto a alguien con viruela del mono y comienza a tener síntomas, entonces la vacuna ya no ayudará. Personas que asistieron a un evento donde había un alto riesgo de exposición, hombres homosexuales o bisexuales y personas transgénero que recibieron profilaxis previa a la exposición de VIH, hombres homosexuales o bisexuales y personas transgénero que asistieron o trabajaron en saunas, casas de baños, clubes sexuales, fiestas de circuito o fiestas sexuales donde tuvieron sexo anónimo o sexo con múltiples parejas, y hombres homosexuales o bisexuales y personas transgénero con diagnóstico de gonorrea o sífilis temprana en los últimos 12 meses. El programa de dosificación para Jynneos exige 2 dosis separadas por 28 días, pero actualmente estamos dando prioridad a que se administren tantas primera dosis como sea posible. Hasta la fecha hemos vacunado cerca de 300 personas aquí en Long Beach. El Departamento de Salud ampliará la elegibilidad a medida que haya vacunas adicionales disponibles. En lo que se respecta al tratamiento, el tratamiento dependerá de qué tan enferma está la persona o si es probable que se enferme gravemente, por ejemplo, si tiene un sistema inmunitario debilitado. Se desarrolló un medicamento antiviral llamado tecovirimat, también conocido como Monkeypox, para el tratamiento de la viruela en adultos y niños. Pero la Administración de Drogas y Alimentos de los Estados Unidos y los CDC permiten su uso para tratar la viruela del mono durante un brote. Los proveedores de atención médica determinarán la necesidad de este tratamiento con sus pacientes y en consulta con el Departamento de Salud. Los esfuerzos de respuesta que ha hecho el Departamento de Salud es establecer una línea de información para llamadas para ofrecer apoyo y recursos y un equipo de divulgación que hace lo mismo en la comunidad, llegando a las personas donde están, como en eventos en Long Beach como Long Beach Pride. Los esfuerzos de divulgación incluyen la participación activa con nuestros mensajeros LGBTQ de confianza para garantizar que también para que tengan la información más actualizada. El Departamento de Salud también abrió una clínica de vacunas en el centro de salud principal y ampliaron las operaciones para aumentar la accesibilidad a aquellos que cumplen con los criterios de elegibilidad. Para aquellos que actualmente están más afectados, les instamos a todos tomar precauciones adicionales para reducir su riesgo. Los recursos para la comunidad que son disponibles incluyen nuestra línea de información de salud pública, que está disponible de lunes a viernes de 9 de la mañana hasta las 5 de la tarde, llamando al 562-570-7907. Tenemos soporte que está disponible en inglés, español, tagalo y jemer. Si está interesado en recibir la vacuna contra la viruela del mono, hay disponible una encuesta de preinscripción para que las personas se pongan a una lista de espera de vacunas. Aquellos que se registren y cumplan con los nuevos criterios de elegibilidad serán contactados con información adicional sobre cómo vacunarse cuando sea su turno. A la fecha tenemos 1,600 personas que se han registrado. También puede consultar su proveedor de atención médica para ver si es elegible para recibir la vacuna. Continuaremos vigilando de cerca la situación al nivel local, nacional y mundial. Como siempre, para mantenerse actualizado, visite nuestro sitio web longbeach.gov/monkeypox y síganos en Facebook, Instagram y Twitter. Gracias. Amairani Cortés. Amarani Cortez. Yeah.
Thank you, Amarani. That'll conclude our press conference for today. Thank you for joining us.